Hi, I'm here today to inform everybody about Alzheimer's. Alzheimer's is the sixth leading cause of death in our country, and that there is no cure for the disease. I found this on www.alz.org. I'm sure many of you know loved ones who suffer from Alzheimer's or may have had someone suffered and died from Alzheimer's, and I'm sure many of you have heard of Alzheimer's before. Alzheimer's is a degenerative disorder that affects the nerve cells in the brain, which result in memory loss. And I found that at www.caring.com. I think Alzheimer's is an important topic to research because it is the sixth leading cause of death in our country. And it could be the leading cause of death in our country because more and more cases are coming up every day, and we have no cure for the disease. While scientists have found links to stuff that could cause the disease, there's no exactly one thing that causes the disease, and there's no one cure for the disease. And I found that at the Journal of Alzheimer's Association, and it was titled A New Direction. Alzheimer's affects people normally around the age of 65 is when you're first diagnosed with Alzheimer's, but you can be diagnosed earlier. There's seven different stages of Alzheimer's. The first stage is the mild stage, which it usually starts around the age of 50, and it's called early onset of Alzheimer's. And that's like when you forget your keys, forget stuff you normally won't forget on a daily basis. And as it progresses, which you're usually diagnosed at the age of 65, according to the website I researched, is www.alz.org. That's the main age when you're diagnosed. And at that time, you're usually in stage like 3 to 4, and it worsens and worsens and progresses to stage 7, which is where you lose the ability to talk, the ability to know the surrounding of your environment, the ability to move, and you depend on someone to take care of you 24/7. There's different types of dementia, but the most common is Alzheimer's, and it's usually 80% of dementia cases are Alzheimer's. Of course, there's other dementia cases like amnesia and that kind of stuff, but Alzheimer's is the most common type of dementia to get. And I found that at www.alz.org. And there's no way to tell if you're going to get Alzheimer's or not. Scientists say the most common way to get Alzheimer's is age, of course, which age is the most common thing to get it. As you get older, that's the most common sign that you're going to get it. But there's, of course, other things that also come along that could higher your chances of getting Alzheimer's, which include, according to scientists, which include high blood pressure, diabetes, heart disease, high cholesterol, which scientists say most of this can be prevented by exercise, taking medicine if it is genetics and you can't lower your cholesterol by yourself. And I found that on www.caring.com. And scientists say there's also other preventive measures that you can take, like reading books every day, walking, doing puzzles, doing math problems, and stuff like that boost your memory and your thinking ability. Scientists can't say for sure what causes it, but one of the things they say is basically genetics. And I found that at www.alz.org. The average life expectancy for someone that has Alzheimer's disease varies. It can range from 6 to 12 years. It just depends when a person gets Alzheimer's. If you get it when you're 50, which is early onset of Alzheimer's, you're usually going to live a lot more years. You can expect to live longer than someone who gets it when they're like 65, is already in stage 4. It just varies, and it depends how severe it is. And I found that at www.alz.org. And now, taking care of someone, I'm sure many of you would like to know, how can you take care of someone that has Alzheimer's disease? It's very hard to take care of someone that has the disease because they require 24/7 care, especially when they're in the severe stage, which is stage 7. To take care of someone that has the disease, you have to be able to feed them, you have to be able to have patience, and you have to be able to you have to be slow to anger, because people with this disease usually lose their temperaments on a regular basis. I found this at www.caring for a patient with Alzheimer's disease.com, and a person with Alzheimer's has to have someone that's going to be willing to work with them and help them. And it's not recommended that you put a patient with Alzheimer's in a nursing home, because usually they can't really talk for themselves, and there's a lot of abuse that goes on in nursing homes, as you may know. And usually it's abuse towards people with Alzheimer's because they can't tell you what's going on. And another thing is, people that work with them in the nursing homes also, a lot of them lose their temper and get violent with the patient that has Alzheimer's because they don't know how to handle the situation. It's best for someone that has Alzheimer's disease to live with a family member or someone related or close to them that they know. And also, patients with Alzheimer's disease come in and out of their modes. Like, one minute they may not know something, but one minute they may come back for a minute, and they may become familiar with their environment. And if they're in a completely different place, like a nursing home, they're going to start flipping out, screaming, and that kind of stuff. So it is recommended that a person with Alzheimer's disease be taken care of by one of their family members if that is possible. Once again, Alzheimer's disease is the 6th leading cause of death in our country. And I was here today to inform you guys about Alzheimer's disease. I hope you guys learned a little bit more about the disease. Once again, it is a degenerative disorder that affects the nerve cells in the brain, which results in memory loss. And 80% of cases of dementia are Alzheimer's disease, and that there is no cure for the disease. And I encourage everyone to research about the disease and try to learn more and try to help find a cure for this disease, because it's an important topic to research, and it could be the leading cause of death in our country one day if we can't find something. So I hope everyone enjoyed the speech, and thank you. I hope everyone has a great day.